In today's video, I'm going to show you a quick and easy taping technique to help prevent hyperextension of the knee. Stay tuned. Hey everyone, welcome to the front row with Ed DeBoo, physical therapist, Bellingham, Washington, integrative physical therapy. A quick case study. 13-year-old high school basketball player has a slight hyperextension injury. So just so we get the terminology straight, this is a left knee, this is flexion, and this is extension. So a hyperextension injury occurred. She landed on that right leg and her leg snapped back into hyperextension. Now, the thing to remember about a hyperextension injury is it can be very serious. So if you have the obvious signs of instability, big levels of pain, inability to put weight on the leg, heard a popping or clicking, obviously stop the activity and go in and see your doctor right away, because hyperextension injuries can cause all sorts of damage internally to the knee. You can hurt the ACL, the PCL, the meniscus, the posterior capsule. There's also a muscle called the popliteus. Back here, I'll put a link to the popliteus muscle. So if you're still having pain in the back of the knee, make sure you check that out as well. This particular girl was lucky. She just had a minor strain and hyperextension of the knee. So what we wanted to do was prevent hyperextension of that knee again. So there's a simple taping technique. They're going to lie prone, which means on their stomach. They're going to be slightly bent in about 20-30 degrees of flexion, and then we're going to put a series of a couple pieces of tape on the back to prevent hyperextension of the knee. So let's take a look. In order to effectively tape, you're going to need two types. You're going to need a cover roll, and you're going to need a brown strapping tape called Leukotape. So this is what it looks like through here. I will put links in the description below so you can pick them up easily on Amazon.
The first thing you'll do is measure out the Leukotape or the cover roll tape, and you want to be about 1.5 to 2 inches above the joint line and below the joint line. And you're basically forming an X. Make sure it's nice and smooth. You put the second piece right over it as well. Smooth it out, make sure there's no folds or creases in the tape. Then comes the strapping tape with the Leukotape. Now this tape you want to make sure does not stay on the skin, and it just completely is on the cover roll. The reason is because this has the potential to irritate the skin a little bit. Two pieces, forming an X, strapping it down firmly. Smooth it out. Make sure there's no wrinkles in it. Adjust the towel a little bit. Pull the towel out, and there you go.
So if you do end up with a mild hyperextension injury, that taping technique is a simple way to help gain some stability of the knee. If it's something that becomes more chronic, you may have to get a brace with a locking hinge to prevent you from going into that hyperextension. Long-term goal with this is, of course, to prevent the hyperextension by gaining better quadricep control, especially at that end range of extension. If someone's got a big anterior pelvic tilt, once again, remember, that's going to increase the hyperextension of the knee as well. All right, so there you go. If you have any questions, let me know down below. I'll also put a link down below to the tape, and if you haven't subscribed yet, please do.